If you're having tailbone pain, this is a video that you want to watch because there is relief options for you. In this video, we're going to break down 3 different exercises that you can do to help relieve tailbone pain. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I'm here to share with you some tips to find relief during pregnancy. Pain is not a requirement of pregnancy, and typically some of the ailments that you may be experiencing, there's some sort of movement or exercise that you can do to find pain relief, to include tailbone pain. But before we dive into the exercises that you can do to find pain relief, I want to share that my book, Training for Two, is now available for pre-order. Training for Two is all about how you can use movements to stay strong throughout your pregnancy with lifting modifications for each trimester, pain-free with pelvic stability and core exercises, and prepare for birth with pelvic opening and pelvic floor release exercises. In the book, we have an entire section about common issues that you may be experiencing during pregnancy specific to physical ailments and exercises that you can do to find pain relief. There is hope for you, and I hope that this video gives you some guidance as well. You can pre-order Training for Two in the notes below, and the book comes out September 10th, 2024. When we're having tailbone pains, we have to understand some of the structures to help us understand why some of these exercises work. The tailbone or the coccyx attaches to the bottom of the sacrum, and there is a joint that attaches the two together. So it's not a singular bone. There's actually 2 components to it. Because of this, the tailbone can actually move around depending on the tension within the pelvic floor. The pelvic floor attaches to the tailbone, and so different types of tension within the pelvic floor can pull it in different directions as well, which could cause some of that discomfort. During pregnancy, because of common postural tendencies or ways that we like to stand, we tend to have more tension to the back half of our pelvic floor, particularly towards that left side, and so the tailbone may be getting pulled a little bit to the left side, causing some discomfort. So for a lot of us, that left hip sits a little bit more forward and that right hip sits more backwards, which can cause a torquing or a change in the bottom of our pelvis. Because of this, you can see that this bone is closer to that tailbone area, while we have a lot more space here on the right. And because of that, the pelvic floor on this left posterior portion can be a little bit tighter, pulling that tailbone towards that left side. Exercises that we can do to find pain relief are going to involve hip shifting, where we're bringing that left hip back and right hip forward to help stretch that tight posterior pelvic floor. And there are a few different ways that we can do hip shifts, and we're going to start with a variation that's down on the floor, and we're slowly going to progress towards more advanced hip shifting exercises. The first hip shift that you can do is going to be a tabletop position, and we're going to use one yoga block to help us come deeper into one hip. I'm going to place my left hip onto the yoga block because that's the hip that I'm trying to drive backwards to stretch that left posterior pelvic floor. So I'm going to start with my left knee on that yoga block, and then I'm going to shift my weight over towards that elevated hip so I can lift my right knee up without changing my body position. If I don't shift over and I try to lift my right knee up, my whole body is going to have to shift around to accommodate for that change in my stability. So I'm shifting my weight over towards that elevated side, and then I'm going to push my belly away from the floor to find some rounding. To start, we're just going to inhale into our back, so the back half of our pelvic floor, our lower back area. I'm trying to push it out. And then exhale, I'm going to lift up in the front side. So I'm lifting in the front side of my pelvic floor, pulling my belly to spine. Big inhale into the back. Exhale, lift in the front. And so when I'm inhaling into the back, this is where I'm stretching that posterior pelvic floor. And then when I lift to exhale in the front, I'm shortening a portion of the pelvic floor that tends to be a little bit more lengthened during pregnancy. We'll do about 10 breaths here, and then you can move into some pelvic tilts to add some movement, where we inhale to drop the belly down, and then exhale to round. You can also take one full round of breath in the rounded position and one full round of breath in the arch position, but we'll do about 10 breaths here. If you want to add a little bit more resistance, we can take a resistance band and put it around our back, so the back half of our rib cage, Bring the hands down to the floor. I'm still shifting my weight over, and then I can round in my back. And this is going to give me some more feedback to find that rounded position. When we have a more rounded back, this tends to stretch more of that back half of the pelvic floor as well. And so I can do my pelvic tilts with the band, or I can hold the back expanded position and breathe here. We can advance the all fours hip shift to a standing position. So this is going to be more activation throughout the body. And for some of us may feel more intense and like we're getting more of a stretch than the tabletop position. So with the standing hip shift, I'm going to start with my left foot on that elevated surface. So again, I want to target bringing this left hip back to stretch the left posterior pelvic floor, which for a lot of us tends to be much tighter. So I'm going to start with my foot on that block, and then I'm going to shift my hips back. So I'm going to feel a little bit more on that left side already. And then I'm going to reach forward with my right arm as my left arm comes back, and this twist in my upper body is going to bring me deeper into this hip as well. And so I'm going to weights in my big toe of that left foot, almost like I'm trying to rotate that left knee in. And then I'm reaching forward to come deeper into that leg. And same thing, I can lift that bottom leg off the floor without really changing my position too much, but it can provide a little bit of balance, but predominantly my weight is in that elevated hip. So from here, I'm reaching diagonally towards the floor. I'm going to push my belly away from the floor to have a little bit of rounding, and then breathing here in a similar way. So I'm breathing into my low back, and then exhaling to lift up in the front. So inhale to breathe into that low back, feel the back half of the pelvic floor kind of push out a little bit more, and then exhale to lift up in the front. We can add a little bit more with a banded row, and this is going to emphasize the upper body rotation. So I'm going to start in my hinge position, coming into my hip shift, and then instead of just reaching with just my arms, I'm going to use the band to kind of bring me deeper into that push-pull motion to help me rotate more in my upper body. So then you can hold this here for about 10 breaths and then release the tension in the band. Another variation is to add some movement. So from here, I can reach forward to look forward with both hands as I extend in the hip, and then shift back into that hip. And so we're focusing on being able to change our position to a more extended hip, back into that hip shift on the left side, because we want to be able to move while we're walking into a hip shift to help release that tension in that pelvic floor. The final hip shift that we're going to show in this video, but know that there are so many more out there, is going to be the archer row and press. So with the archer row and press, we're adding in that movement and the upper body rotation to help us get deeper into our hips. And so to come onto the left side, I'm going to hold the band in my left hand, and my left foot is going to be a little bit more back than my right. From here, I'm going to row that band back as I reach forward with my right arm, and I'm kind of crunching towards that left side, shifting into my left hip. So there's not as much weight in that right foot. I have a lot more weight in my left foot. And when I row back, I'm shift my weight to the left hip as I rotate in my upper body, keeping weight in that big toe. So we're going to exhale to row back as we crunch in that left side, shifting belly to thigh, and then inhale to release. And just kind of going back and forth between these two. If we want to add a little bit more, we can also step that right foot forward and backwards to kind of emphasize the hip rotation that's happening. Next, we're going to move into the archer press, still targeting that left leg. So left leg is going to be behind because this is going to allow us to shift into it. I'm going to hold the band in my right hand, facing away from my point of attachment. I'm going to reach forward with that left arm, and then exhale to press the band out and kind of cross my body as I find more length in this right side body and crunch a little bit towards that left side, shifting my weight into this hip. So tons of weight in that big left toe. Inhale to come back, and then exhale to press forward as I rotate. If I want to add a little bit more, I can step forward and backwards with that right leg as well. If you don't have an attachment point, you can also do the archer row and press with a free band as well. So holding onto the band, I'm going to use my hands as an anchor point. Step that left foot back. I'm going to keep that right arm forward as I row that left arm back to find that slight crunch, shifting into that left hip, coming back forward. Exhale, row back. Inhale, come forward. And then to do the opposite, where I'm pressing the band forward, I'm going to start with it in my chest and then press that right arm out as I reach across and then come back in. So you can also do this with a free band without attaching it to an attachment point. So you can use those 3 exercises and so many more to help find a hip shift to release tension in that posterior pelvic floor, which could be influencing where the tailbone is moving. If you want more exercises to help you find pain relief throughout your pregnancy, check out our online prenatal fitness programs. Our online prenatal fitness programs are designed to not only keep you strong throughout your pregnancy, but also pain-free, with tons of hip shifting exercises, pelvic floor release exercises, and improving your mobility of your hip and your rib cage so that we have a lot more movement happening within our pelvic floor. We offer our online prenatal fitness programs in 2 main formats. We have our app-based program, which is going to be a list of exercises with short demo videos. This is going to be a self-paced program that is a great option for somebody that prefers to work out at their own pace, in addition to a gym setting. And then we have our full-length workout videos with our Prenatal on-demand program. So if you prefer to follow a video as you work out at the same time, this program can be a great option for you. Both programs can be started at any point during your pregnancy because they sync to where you are at. So the app-based program syncs to your current week of pregnancy, while our on-demand program syncs to your current trimester. You can check out all of our prenatal fitness programs on our website below and use code YouTube10 to get 10% off. And you can bundle prenatal fitness with our childbirth education course, which is going to teach you the science of birth in a lot of detail like we described in this video. You can bundle the 2 together to save an additional 15% off. If you enjoyed this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We're here to support you throughout your pregnancy, birth, and beyond.